Hello, beautiful people. So, I'm feeling better today. I'm still struggling, but I'm getting there. I think I figured out the problem. I don't think my doctors are paying any attention. They're all willing to take that one risk, that one medication. It's not perfect, but it's a low risk. But they don't always inform me of the low risks, of the rare side effects. What I have found out in doing my own research is I'm on 2 medications you probably shouldn't be on if you have anxiety. I have acute anxiety with agoraphobia. A couple you shouldn't be on if you have depression. I have major depressive disorder with CPTSD. I'm on, I think, 3 that you're not supposed to take if you have a heart condition, and I have a heart murmur. I'm on 5 medications that can suppress my breathing. When I finally put all of my medications into a list, I had over 26 drug interactions. I was aware of 2 that I had to be careful of. Doctors never think that anybody's going to get the rare side effects, but some of us do. And because of that, I probably had a minor heart attack. And now I don't know what I can and can't take. I don't know who to trust. It seems that the final issue was the ENT specialist. For 5 years, I've been trying to figure out what's going on with my sinuses. Why food and liquid come out of my sinuses. Most likely it's soft palate dysfunction because of my Ehlers-Danlos and valve issues that, your tear ducts are only supposed to go one way. You're not supposed to have anything come out of your tear ducts into your eyes, but I have had food and drink come out of my tear ducts. I've had snot go into my eye when I was congested. Because with hypermobile Ehlers-Danlos, that valve doesn't work just one way. I've been terrified about losing my hearing because of what's going on in my sinuses. But every doctor I go to saying I'm worried about losing my hearing, that's where they stop listening. They send me for a hearing test. Oh, your hearing's fine. Why are you even worried about it? It's tube dysfunction. It's pressure problems. That's what I'm worried about. I don't know what's going on in my sinuses to tell me what's going on in my ears. WellSpan didn't help me. In fact, they almost killed me. So I went to UPMC. UPMC, they just did a hearing test. The ENT wasn't prepared to handle somebody like me. So they sent me to Hershey. Hershey, they were really just looking at my soft palate. Like, I'm not worried about my soft palate. I want to know that the nasal irrigation system isn't doing damage to my ears. Because every day I have to use a nasalage system, which is it's a wet vac for your nose. It shoots water up one nostril and sucks it out the other. She said I had inflamed sinuses, and so she prescribed this to help with the inflammation. This is what almost killed me. One interaction too many. One rare side effect. I feel better now, I think. I just don't know who to trust anymore. Doctors never think you're going to have the rare side effects. But it almost killed me. I really thought I was going to die. So I see my regular physician today. I emailed her a week ago saying I was starting to become concerned because I was getting these strange hives all of a sudden. The only things that had been added were 3 antihistamines for my mast cell from my Ehlers-Danlos doctor, and this nasal spray. They asked for pictures. I sent in pictures. They said it looks like heat rash. Just try to put a cold compress on it. And then I had a heart attack. This medication, its rare side effects: hives, rash, suppressed breathing. 5 medications that could suppress my breathing. I was told to use this at night. Try to only rinse my nose once a day when I'm done eating, and then use it right away. I did that, so I would wait until the evening when I was done eating. I'd flush my sinuses. I'd use my nasal spray. And then I would take my medications like I'm supposed to, like you're prescribed. And I would have trouble breathing. I started to feel weak. I started to feel like I couldn't use my muscles. I started to feel like I was trying to breathe through mud. They told me I was getting plenty of oxygen. My oxygen saturation was through the roof, but I felt like my lungs were not moving unless I forced them. I typed in my medications into a tracker thing today. I didn't even get through all of them. 26 interactions. I don't think there's a way for me to take all of my prescriptions without having interactions. There's not enough hours in the day. I'm not supposed to take magnesium too close to my gabapentin. Nobody told me that. Guess what? I was taking them at the same time. When you have chronic illness to the degree that I have, let's go over the list a little bit here. Okay. I have celiac disease. That's an easy one, just no gluten. I have Hashimoto's, They ignored that one for years, told me they were testing for it, but they weren't. By the time I was tested, and for those of you out there who know, my levels were at 143. Over 20 is Hashimoto's. I have hypermobile Ehlers-Danlos. With that comes mast cell activation syndrome and postural orthostatic tachycardia. I have a heart murmur, an extra little half beat. Severe depression, moderate depression, severe anxiety with agoraphobia, CPTSD, polycystic ovarian syndrome, narcolepsy with cataplexy, ASD, ADHD, dyspraxia, I have ARFID. So technically I even have an eating disorder. It's now classified as one, as it should be, due to food trauma and autism. I could go on, but I don't think I have to. I think you guys get the picture. I have to go through 3 separate medical facilities to get the care I need. They're all aware of each other. They all have the same information. They all think they are the most important. They're all willing to take that one small risk, that one possible side effect. This was one too many. I have bulius phemogoid. I have a history of spinal meningitis with encephalitis. I have a lot going on with me. All my life I was called a hypochondriac because my mother hid it from me. It was easier to abuse me that way, pretend that there's nothing wrong with me. Oh, you know, that's just Bethy. She likes to make up stories. She's so dramatic. Five medications that can suppress my breathing. And when I'm telling people I can't breathe, they're telling me to relax. I'm not very relaxed right now, am I? I've done everything in my life to do exactly what the doctors have told me. The
The doctors didn't tell me that they were taking a risk with my life. Because maybe one rare side effect, it's worth the risk. The breathing problems got worse and worse as I was using this nasal spray. Everybody sort of blamed it on anxiety because I just lost my father-in-law. Things have been a little tense. I started developing hot flashes, which isn't uncommon for me, but I was suddenly getting them where my ankles, knees, hips, wrists, ankles, shoulders, spine, upper chest were getting hives when I had them. And it got harder and harder to breathe. Those are serious side effects of this medication. So I went to the ER. Was mistreated by a paramedic. Locked outside my room within earshot of me for 40 minutes. Laying on cold, wet bedding. Having a heart attack. Alone. As they discussed one of the nurses becoming a grandmother. And what were their grandkids gonna call her? She was a nice lady. I congratulated her. But sometimes you just need to do your fucking jobs.